Thank you, Clive. Welcome to Look North. Coming up on tonight's programme. 4 years after the pandemic, the lingering effects of long COVID. A new report says our region is among the worst hit.
I thought I was going to die more than once. I thought I'd had a stroke, severe pressure in my head, inability to walk. It's had a huge life-changing impact.
We'll be asking one of the authors of the report what more needs to be done to support those with the condition. Good evening. Thank you for joining us. I'm Alison Freeman. The North East is among the areas with the highest number of people in the country living with symptoms of long COVID. According to a new report from the research group Health Equity North, GP data shows more than 5% of patients across the North East and North Yorkshire are still suffering from the effects of COVID-19. That's compared to around 3.5% in the South East, while the national average is just under 4.5%. Shortly, I'll be speaking with one of the authors of the report. But first, Phil Chapman's been to meet two people living with the condition.
At her worst, Claire thought she might die from COVID and had to use a wheelchair. She went on to develop long COVID and formed an online support group from home near Durham for others like her. She's not surprised today's report highlights a north-south divide.
I thought I was going to die more than once. I thought I'd had a stroke, severe pressure in my head, inability to walk. It's had a huge life-changing impact. I'm not really surprised that the North East has high levels of long COVID. I think poor healthcare outcomes are associated with areas of deprivation, and I think the North East has lots of postcodes that would fall into that category with complex social and economic and healthcare needs. Long COVID is something that is very, very difficult to recover from.
Claire's support sessions often include people from around the world. Closer to home, fellow long COVID patient Andrew has seen his life devastated by the condition and says he'll be joining Claire's sessions from home in Newcastle.
We need some resources there for us. I mean, this report is just the best news we've ever had as sufferers, because it's bringing to the forefront to the government that they have to take notice. There's people suffering and people's lives are drastically changing. My life was white. COVID now, my life is black.
Dr. Stephanie Scott is a senior lecturer in public health at Newcastle University and was a lead author of the report.
We undertook a piece of work exploring the prevalence of long COVID, so post-COVID syndrome in the north. The 10 practices with the highest levels of long COVID reported amongst their patients were all in the north.
As just two examples, the highest prevalence of long COVID in the North East was at a GP practice in Hartlepool at 18% of patients. And in Cumbria, the highest was in Whitehaven at 12%.
July 2022, I had to give up work because I couldn't fulfil my obligations in my role. And in January 2023, they terminated my contract. So it's hard, really, because I led such an active and happy life. This room is my home, my bedroom, and I just live in this room now.
I think it's vital that the government invests more in long COVID. It's the biggest health crisis in a century.
The Department of Health says it recognises the impact of long COVID and has launched an investigation into the extent of the issues facing the NHS. The government says it's committed to ensuring everyone is able to access the care they need. But as a patient, how does Andrew see his future now?
To be honest, Phil, I just don't know. I don't know.
Phil Chapman, BBC Look North.
Well, watching that report with me is Hannah Davis, one of the authors of the report. Really some quite devastating effects there. Were you surprised by what you discovered?
On one level, we weren't shocked, we weren't surprised, because we know we've done a number of reports looking at the incidence of COVID across the north of England, and COVID hit the North East harder and the North in general harder than it hit the rest of the country. We saw more people dying from COVID, we saw more deaths in care homes, so it makes sense that we would have the biggest issue with long COVID. The things that did surprise me was that the number of people suffering with long COVID is still so high, and actually the extent of the suffering that they have, which devastates people's lives.
Very much we saw that there, didn't we?
Absolutely.
The other thing we noticed is this north-south divide. It's really quite stark, isn't it?
It is, and there's a number of reasons for that. So underlying all of it is the worse health in the north, and a lot of that is driven by poverty. The sad fact is, though, the north is brilliant, we do have greater poverty levels than the rest of the country, and that has a big impact on our health, directly impacts our health. So it's not surprising when the pandemic comes that those who've already got poorer health are hit hardest. And the report finds that people in deprived areas in the north and the northeast have even worse outcomes than those in deprived areas in the rest of the country. So we've got a double whammy of deprivation.
So, you know, they were talking about the fact they felt forgotten. What can be done to help them? What needs to be done, do you think?
There are a number of things that need to be done. So we know that there's likely to be another pandemic some point in the future. And we haven't learnt from post-viral diseases such as myalgic encephalomyelitis and other post-viral syndromes. And we don't seem to be learning from long COVID. So we need investment in biomedical research into treating long COVID and other post-viral symptoms. And then we need to tackle the underlying causes of ill health, which are driven by deprivation and poverty. We need to see reinvestment in the northeast in some of the welfare systems, and we need government to look at how it can support employers, help people with long COVID when they are ready and when they are able to get back into work.
Hannah, thank you. That's very interesting. Thank you so much for joining us this evening.
Thank you.